Are you dealing with pain under your shoulder blade? It's a nagging pain that many of us just tend to live with. But the good news is you don't have to. In this video, I'll share 5 common causes of shoulder blade pain, plus some simple solutions that you can try at home. So let's dive in. Now, first of all, there are some serious things that can cause pain underneath the shoulder blade. So you want to rule out any internal organ problems, such as problems with your lungs, your heart, your liver, your gallbladder, or your stomach. Now, I won't discuss those any further in this video, but it is important to get that checked out. Next, we'll move on to pinched nerves in the neck, because that's one of the most common causes of pain underneath the shoulder blade. The nerve roots from C6, C7, C8, and T1 can refer pain down into your shoulder blade. Now, commonly that's caused from sitting with a forward head posture like that, where it starts to pinch the nerve roots in your lower neck. And those can refer pain down your arm, but it can also go down into the shoulder blade. Now, the good news is that just by correcting your posture, keeping your chin tucked down and head stacked over top of your shoulders, that helps open up the spaces where the nerves come out of your neck and can help relieve pain in your shoulder blade if it is coming from your neck. Additionally, if you spend a lot of time working at a computer, if your arms are hanging down low, that pulls your shoulder blades down, pulls tension on your neck muscles, which can then compress your vertebrae together and also pinch your nerves in your neck. So another solution is just making sure that you use arm rests when you're working at a desk, or rest your arm on the desk itself so that you're not having constant pressure pulling down on your neck and pinching the nerves that go down into your shoulder blade. Now, another cause of nerve pain in the shoulder blade is actually the thoracic nerves. The thoracic nerves tend to wrap around at the level that they come out of. Now, any of the upper thoracic nerve roots, T1 through T7, can cause shoulder blade pain. You can get an infection of a nerve root, such as shingles, and that can cause a rash as well as a burning pain around underneath your shoulder blade. However, you can also get pinched nerves in the thoracic spine. Many people don't think about this as much as they do in the neck and the lower back, but you can also get either bulging discs, herniated discs, or degenerative discs in your thoracic spine that can pinch on nerve roots. Now, many people think about a slouched, rounded posture like this as causing nerve problems in the thoracic spine. But actually, what I've found more commonly is people who tend to focus on sitting really upright and having their shoulder blades really pulled back together tend to develop hypermobility problems in the upper back and causing pinched nerves that goes into the shoulder blades. Often the rounding in the upper back happens at the upper thoracic spine and the lower thoracic spine. But the middle thoracic spine between the shoulder blades often becomes flat. And one good way to address that is putting your arms out like this and rounding out the upper back like this. This helps open up the spaces where the thoracic nerve roots come out. It also helps stretch out the muscles between the shoulder blades, such as the trapezius and rhomboids, which will be the next cause of shoulder blade pain that we discuss. Before we do that, though, there's one more tip to help out with thoracic spine pain, and that's using a foam roller. Just rolling up and down on a foam roller like this can help mobilize the joints in your thoracic spine, and sometimes you get little snaps or pops that feel good. You can position your arms either across your chest like this to get your shoulder blades out of the way, or support behind your neck if you need neck support. Now, oftentimes you will have trouble getting directly between the shoulder blades because your shoulder blades will block the area between, and that's where your rhomboids are, which is the next thing that we'll talk about, stiff muscles in the shoulder blades. The rhomboids and trapezius sit in between the shoulder blades, and so if you can't get in there with the foam roller, you can take a tennis ball and put it in the area between the shoulder blades like that. So laying on it like this with it underneath your shoulder, you do have to maneuver around a little bit to get it in the right spot. But once you find it, get it between the shoulder blade and roll around there to get your rhomboids, or a muscle on the back of your shoulder, right back here, known as the infraspinatus, can also refer pain into the shoulder blade. So to get the infraspinatus, you just put the tennis ball right on the back of the shoulder blade, like that. And then again, roll around until you find the sore tender spot. Now, once you do find a sore tender spot, either in your infraspinatus or in your rhomboids, then you just lay there with a little pressure on it for about a minute or two until the pain starts to melt away. Now, an additional trigger point that can refer pain into your shoulder blade is a muscle underneath the shoulder. It's called the subscapularis, which literally means underneath the shoulder blade. Now, that's a hard muscle to massage or get to. You can get to small components of it if you either dig in like that with your fingertips and press against the front side of the shoulder blade, or if you dig your thumb down into your armpit like that and press really back deep until you hit a bone. But this is a tough one to get to on your own. Treatment from a physical therapist or a massage therapist can help access it a little bit better. And then another really common stiff muscle that can cause referred pain into the shoulder blade is your levator scapula. That's a muscle that runs right back here from your neck down to this bump right on the top of the shoulder blade. Now, the levator scapula pulls your shoulder blades up and also downwardly rotates the shoulder blades. So before stretching the muscle, you first want to determine if the shoulder blade is elevated or depressed. If the shoulder blade is too high, that shortens the levator scapula muscle and you'll want to stretch it. If the shoulder blade is too low, that can also make the levator scapula hurt and develop knots. However, stretching it further probably isn't a good idea. So if you've got knots or pain under one shoulder blade, take a look in the mirror and notice if the shoulder on that side is higher or if it's lower. If it's higher, doing a stretch for your levator scapula like this, where you turn your head away, side bend it away, and turn your nose towards the opposite armpit can help. It also helps to hold on to the side of a chair or put this arm behind your back to help keep the shoulder blade held down. And then hold this stretch for about 30 seconds to a minute. It should be just a very gentle stretch right back there. Now, if your shoulder blade is lower on the painful side, then you may have the opposite problem, that muscles are overstretched. And that's the last cause of shoulder blade pain that we'll discuss, is that overstretched muscles can cause pain too. Particularly your upper trapezius muscle, your levator scapula, or a muscle that runs from your rib cage underneath the shoulder blade called the serratus anterior. When those muscles are overstretched, you may also get stiffness or tightness of your latissimus dorsi or lats, the muscles underneath here, as well as the rhomboids between the shoulder blades. Now, fortunately, there is one exercise that can help out with all of those problems. Your rhomboids, your lats, and your levator scapula downwardly rotate the shoulder blades like that, meaning they pull this part lower. Conversely, your upper trapezius, lower trapezius, and serratus anterior rotate your shoulder blades upwards, meaning they bring the edge of the shoulder blade away from the center of your spine and rotate the ball of your shoulder upwards. So an exercise that helps out with that problem is an upward rotation exercise where you put your arms on the wall like this, you reach up, and then you think about raising your shoulder blades and arms all as one unit, kind of shrugging your shoulders up. Hold that for about 10 seconds and then come back down. Doing this strengthens your upper trapezius, serratus anterior, and lower trapezius while stretching your rhomboids, lats, and levator scapula. So those were the tips to relieve shoulder blade pain. Leave a comment below letting me know which ones you like the best. And if you'd like more tips to relieve a pinched nerve in your neck, check out this video over here. Or for more shoulder pain relief tips, check out this playlist over here. But before you go, if you found this one helpful, make sure to give the video a like and subscribe to our channel so you don't miss out on future tips. Thanks for watching, and I'll see you in the next one.